what are some common signs and symptoms of lymphedema? So I'm going to run through a few different very common signs that most patients will see or feel. So the first one is a feeling of tightness and heaviness in the limb. So even if you're not able to visually see the difference between your right and your left leg in terms of swelling, it feels heavier. It gets fatigued quicker when you're walking around a lot. Slight swelling that may come and go. In the morning, it may be a little bit better because you're lying horizontal for so long, and then you get up, and as the day wears on, you feel that the swelling starts to get worse. Bursting pains. Pain's not always associated with lymphedema, but that's definitely something that could occur for you. Aching buttocks if you're having lymphedema in your legs, or aching in the back of the shoulder if you're having issues with swelling in your arms. Pins and needles, shooting pains up and down the limb. That can also occur. You might have some tenderness at the elbow, under the arm, or the back of the knee when you're putting a little bit of pressure with your hand on it. And then the joints also may be painful. And when you think about painful joints, don't just always assume it's arthritis or degeneration of that particular joint. If you have lymphedema, it's very possible that you're feeling that pain or that joint issue because of the lymphedema itself. So a lot of times, actually, it's misdiagnosed as far as being arthritis when it in fact is just kind of a side effect of the lymphedema. Tenderness of the groin if you're having leg lymphedema. A feeling of being blown up or bloated if your abdomen is affected. So not necessarily feeling like, oh, my pants feel tighter, it's harder to button them, but feeling like that bloated feeling all the time, no matter what you eat, no matter what, you intake as far as fluids. It doesn't matter. You always have that feeling. The swelling most often progresses upward from the hand or the foot. It's not always the case, but I would say it's definitely majority. So if you have leg swelling, you see it most prominently in your foot and ankle, and then as it comes up towards your knee, it's a little bit less. Same thing with your arm. Your hand and your fingers you may feel to be more swollen, and then as it travels up your arm, it gets a little bit less and less. One of the things I want to go over is risk factors as well. So one of the big risks of having lymphedema is that you are more prone to developing cellulitis. So what is cellulitis? Cellulitis is a skin infection. If you are not diagnosed and treated with an antibiotic for cellulitis, it could cause major issues. So that's extremely important to be able to recognize and to be able to take care of and know exactly, that you need to go to see the doctor right away to get on this. So why does lymphedema increase the risk of cellulitis? So lymphedema fluid is rich in protein, which we've talked about before. When your lymphatic flow is obstructed, the fluid is accumulating, and it basically lays stagnant wherever your fluid's accumulating, whether it's in the ankle or the hand. And so basically it being stagnant, it creates a very good environment for bacteria to start growing. So if you think of how mosquitoes are bred, you have a kiddie pool of water that you never emptied, or a bird bath that you never emptied, and that stagnant water then gets warm in the summer months in Florida, and it can start breeding different bacteria on it, and different things can start growing there. So the same thing with lymphedema. So we have to be really careful in terms of hygiene and making sure we're doing these techniques so that you're preventing those issues from happening. So what is cellulitis? How would you know what to look for if you think you might have cellulitis? So it's usually a very superficial type of infection, so very close on the skin. You can definitely observe it with your eyes and be able to see what's going on. It's usually because that body's defense mechanism. So when that bacteria starts to grow, it starts to do this automatically and starts creating these different signs and symptoms for it. So your body knows, okay, something right here is not going on, is not correct. So symptoms of it is localized redness or inflammation that increases in the size as the infection spreads. So it could start with a very small area on your arm, and then it starts getting more and more spread. So a great way to track that is, if you're not sure what it is, use a pen or a Sharpie and circle the area. And then the next day, is it bigger? Is it outside of my circle now? And you're able to track if it's spreading. It's also a tight, glossy, or stretched appearance of the skin. Pain and tenderness definitely falls into that. And it looks like a skin lesion or a rash that has a sudden onset, so it started pretty quickly. It's not something that took, months or years to occur. It has sharp borders, so it's not a perfectly round circle. It's not a perfect, shape. It's very, very ragged with the shape. And in the first 24 hours of this happening, there is rapid growth. So like I said, if you circle it at the beginning, when you first notice it, you will notice if it's spreading within that first 24 hours. You can also feel warmth. So if you're touching that area of your skin, you will feel like a heat emitted from that. And fever can associate with that as well. So taking your temperature is, a good idea to do also to make sure that you're not suffering from a fever as well. Other signs of general infection, so anytime you have any type of infection is going to apply to this as well. So chills and shaking, warm skin, sweating, fatigue, muscle aches, pains, and just like a general ill feeling. Okay, so those are the signs and symptoms. What are some things that can expedite cellulitis from occurring to start? What are some things, not just the lymphedema in general, but what are some things that can really make it fire up quicker? So if you think of your limb as a balloon, okay, the more fluid and the more water I put into it, of course, the more it's going to expand. Okay, so you think of all of the different skin types, the different cells that you have within your skin, and the hair follicles that come out. So let's talk about your leg right now. So you have hair that comes out of your leg. As that balloon expands with fluid, those follicles where the hair comes out becomes more porous now because it has that pressure pushing on it. So it's more porous with your skin and around the hair follicles, so it's more now susceptible to picking up any type of outside bacteria. So not just the ones that's kind of, from that stagnant fluid, now it's coming from the outside, right? So keeping your skin extremely clean is way more important now with a diagnosis like lymphedema or chronic swelling than it was before. So making sure you're consistently washing off your skin, you're drying it completely, you're not leaving areas of hot, moist, sections to harbor even more bacteria. So super important, like between your fingers, between your toes, things like that maybe you weren't so diligent about doing before are now going to be vital. Some other things that are going to cause your increased risk of cellulitis would be any type of insect bite or sting, any type of cat scratches, if dog scratches, if you have pets. Those things are going to puncture the skin, and because you have that increased swelling on the skin, in order to close those edges, it's going to take a lot longer. You'll notice if you do get a cut or a scrape, it takes a lot longer for that area to heal than it would on an area of your body that you don't have the swelling like that. So making sure you're super clean and hygienic in terms of, washing and drying everything. Another thing to keep in mind are keeping your toenails or your fingernails cut. Ingrown toenails, that can cause, another risk factor in terms of developing cellulitis. So make sure they're well kept up. And if you need to see a podiatrist to help you with this, I think that's a great investment in terms of making sure you don't have any other medical issues arising from something as simple as it sounds, that can be, devastating if you get cellulitis. Another thing to keep in mind are something people use on a almost daily basis that can really expedite you getting cellulitis: a razor. Okay, so using a razor when you're shaving the hair off your leg, it can harbor bacteria between the razor blades. So if you are shaving and that razor is left in a environment where it's moist, in a shower, definitely creating a great place for that bacteria to build a tome in between those razor blades. And as you're shaving, you're creating very small micro tears by doing that. So those razors will now, the next time you go to shave, if there's bacteria already in that razor and you go to, go brush over your skin and it already has that micro tear, plus you're more porous, you're more opened up because of the fluid, now you're more susceptible to picking up the bacteria from that razor. Same thing goes with the electric razors. Those things can harbor tons of bacteria, and to normal areas of the body that don't have issues with swelling, that's not really a problem. But when you are more susceptible to picking up this bacteria and it infiltrating into your circulatory system, the best option for hair removal would be some type of Nair lotion or something like that, so you're not putting yourself at risk with something that seems very simple and that, like I said, you do almost every day.